You've just been told your kidney function is lower than normal. Maybe your doctor mentioned kidney damage, or maybe you saw an abnormal result on your blood test and immediately started wondering, can kidneys actually heal? It's one of the most common and most frightening questions people ask after hearing something might be wrong with their kidneys. The answer isn't as simple as yes or no. By the end of this video, you'll understand exactly when kidneys can recover, when they usually can't, and the one crucial difference that changes everything. If you or someone you love has ever been told your kidney function is lower than normal, you already know how unsettling those words can feel. It sounds final, almost as if something inside your body has been permanently damaged. For many people, that single sentence starts days or even weeks of worry. You search online, read conflicting articles, and before long, it feels like every result points to the worst possible outcome. The truth is, that's where most of the confusion begins. The internet often talks about kidney disease as if it's one single condition with one predictable future. It isn't. Two people can have similar lab results and yet face completely different situation with one predictable future. It isn't. Two people can have similar lab results and yet face completely different situation. The KINs. Some types can improve significantly, while others require a very different approach. In this video, we'll separate the myths from the science. We'll explain what current medical research really says about kidney recovery, why some kidneys heal while others don't, and most importantly, how doctors determine which situation applies to you. Here's the first thing almost nobody explains clearly, and it's the root of most of the confusion around this topic. Kidney damage is not one condition. It's two very different situations that get lumped together under the same scary phrase, and mixing them up is exactly where most of the unnecessary fear comes from. The first is called acute kidney injury, often shortened to AKI. This is a sudden drop in kidney function that happens over hours or days, not years. It's usually triggered by something specific: severe dehydration, a major infection that spreads through the bloodstream, blood loss during surgery, a reaction to certain medications, or a physical blockage somewhere along the urinary tract. It's less like the organ was destroyed and more like it got knocked offline by an outside event. The second is chronic kidney disease, or CKD. This develops slowly, usually over years, and it's most often driven by long-term conditions like high blood pressure and diabetes. Instead of a sudden shock, it's a slow, steady process of scarring inside the kidney's tiny filtering units, called nephrons. Almost nobody realizes just how different these two processes look at the tissue level under a microscope. And that difference is exactly why their outlooks are so different from one another. Think of it this way: acute kidney injury is like a power outage in a house. The wiring is still fine, it just temporarily lost electricity from an outside event. Once the cause of the outage is fixed, the lights can often come back on, sometimes fully, sometimes almost fully. Chronic kidney disease is more like slow water damage building up behind a wall for years before anyone notices the warped paint on the surface. By the time it's visible, some of that structural damage has already happened, and no amount of drying out the wall brings back the material that has already been replaced by something else entirely. It directly answers the question in this video's title, but only partway, because even within AKI can often improve, there's a second layer that researchers have only mapped out clearly in the last couple of decades. That's exactly where we're headed next. So can the kidneys actually heal? For acute kidney injury, the honest answer is often yes, at least partially, and sometimes close to fully. Reviews of patients who experienced a sudden, severe injury show that when the underlying cause, whether that's an infection, dehydration, or a medication reaction, gets identified and treated quickly, kidney function can climb back toward its previous baseline over the following weeks to months. Doctors typically want to see about 3 months of follow-up before deciding whether recovery has plateaued, because kidney tissue can keep improving slowly well after the initial crisis has already passed and the patient feels fine again. But here's what most people don't know about that recovery window. Not everyone bounces back the same way, even with identical treatment and identical starting lab numbers. Someone who was completely healthy before their kidneys were injured tends to have a noticeably better shot at returning to near normal function. Someone who already had some underlying chronic kidney disease before the acute injury hit is far less likely to return all the way to their starting point, and the injury itself can permanently accelerate the chronic disease that was already quietly progressing underneath. That single factor, what your kidneys looked like before the injury ever happened, turns out to matter more than almost anything else in this entire story. This is exactly where we come back to those two patients from the opening. Same creatinine number on the day they walked in, but one of them had genuinely healthy kidneys before a bad infection knocked them down. The other had years of undiagnosed high blood pressure, quietly scarring their kidneys long before this particular hospital visit ever happened. The acute event looked identical on paper, down to the decimal point. The tissue underneath it was not. Keep that in mind, because it's going to matter again by the end of this video, and it's the answer we've been building towards since the first sentence. Before we move into chronic kidney disease, it's worth pausing on one more piece of the acute kidney injury picture, because it explains why doctors are sometimes cautious even when the news looks good. A younger person with no other major health issues tends to recover more completely than an older person managing heart disease or diabetes alongside the same acute injury. The severity of the injury matters too. Some cases of AKI are mild enough that kidney function barely dips before bouncing back within days. Others are severe enough to require temporary dialysis just to support the body while the kidneys work through repairing themselves in the background. Here's where it gets interesting. Needing dialysis during an acute injury doesn't automatically mean permanent kidney failure. Plenty of people who needed short-term dialysis during a severe AKI episode came off it completely once their kidneys recovered enough function to take back over. The length of time someone needs dialysis during recovery, though, is one of the stronger predictors doctors watch closely, because a longer dependency generally points toward a lower chance of full recovery. Now let's talk about chronic kidney disease specifically, because this is where the word heal starts to mean something genuinely different, and where a lot of well-meaning advice online gets dangerously overconfident. The kidney doesn't grow brand new filtering units the way skin regrows after a shallow cut. What researchers found next was unexpected to a lot of people the first time they hear it. Even though the scarred tissue itself can't come back, the remaining healthy nephrons can sometimes work harder and more efficiently to compensate, and the overall rate of decline can often be slowed dramatically, sometimes almost flattened out for years at a time, with the right treatment. That distinction matters enormously for how you should think about a CKD diagnosis, if you or someone close to you has received one. It is not the same as watching a countdown clock ticking toward an inevitable ending. For many people, especially when the disease is caught in its earlier stages, blood pressure control, blood sugar management when diabetes is involved, and certain protective medications can stretch out useful kidney function for a very long time, sometimes decades. There's one detail most people miss here, and it's worth sitting with for a second. Not getting worse is a genuine, measurable medical win, even though it doesn't feel as dramatic or as satisfying as getting better. A kidney that holds steady at the same function level for 10 straight years because of consistent treatment is a real success story, even if the number on the lab report never climbs back up to where it started. So where does that leave the actual answer to, can kidneys heal? It depends almost entirely on which kind of damage we're talking about, and that's exactly why doctors run specific tests, like imaging that checks kidney size and shape, along with a careful review of how quickly the change in function actually happened, to figure out which situation someone is really in before making any promises about the road ahead. This is also a good moment to explain the staging system doctors actually use, because the number attached to a CKD diagnosis changes what it means enormously, and almost nobody outside a doctor's office ever has it explained clearly. Chronic kidney disease is generally described in 5 stages, based on a measurement called the glomerular filtration rate, or GFR, which estimates how efficiently the kidneys are filtering blood. Stage 1 and Stage 2 involve mild reductions in function, often with no symptoms at all, sometimes discovered almost by accident during a routine blood test for something unrelated. Stage 3 represents a more moderate drop, where doctors typically start paying much closer attention and adjusting treatment more aggressively. Stages 4 and 5 represent more advanced disease, with Stage 5 being what's often called kidney failure, where the kidneys are no longer able to keep up on their own and dialysis or a transplant eventually becomes necessary. The surprising part is this. A Stage 3 diagnosis today does not mean someone is automatically heading towards Stage 5. With consistent management, many people spend years, sometimes the rest of their lives, without ever progressing to a later stage. Let's slow down for a moment and look at what's physically happening inside the kidney itself, because this next part explains almost everything else in this video. Each kidney contains roughly 1 million tiny filtering units called nephrons, and each one acts like a microscopic sieve, pulling waste and extra fluid out of the blood while holding on to the things your body still needs. In acute kidney injury, those nephrons are often simply stunned. The cells lining them can be injured by low blood flow, by toxins, or by inflammation. But many of those same cells have the ability to repair themselves and start functioning again once the stress is removed, similar to how skin cells regenerate after a bruise heals from the inside out. Almost nobody realizes that this cellular self-repair is actually the biological reason AKI recovery is possible at all. There's a phenomenon inside this healing process worth understanding too, called hyperfiltration, and it's a good example of how the body tries to compensate on its own. When some nephrons are lost, whether from an old injury or early chronic disease, the remaining healthy nephrons can actually increase their own workload to make up part of the difference, filtering more blood per unit than they normally would. In the short term, this compensation can hide the true extent of damage on a basic lab test, because overall filtration numbers might look reasonably steady, even while total nephron count has already dropped. Over the long run, though, that extra workload can gradually wear down the remaining nephrons faster than normal, which is part of why chronic kidney disease can sometimes seem to progress slowly for years and then accelerate later on. This next one catches almost everyone off guard. It's exactly why doctors track trends over time rather than a single test result, because one snapshot can look deceptively reassuring on its own. In chronic kidney disease, the process is fundamentally different: persistent high pressure, persistent high blood sugar, or long-term inflammation. Scar tissue doesn't filter blood. It's structural, not functional. This next one catches almost everyone off guard, because you're born with far more nephrons than you strictly need day to day. Kidney function tests often don't show a problem until a meaningful percentage of total nephrons are already gone, sometimes as much as half. That's exactly why routine testing matters so much more than waiting to feel symptoms, because by the time symptoms show up, the disease has usually already been progressing quietly for a long time. Let's get practical now, because knowing the biology only matters if it actually changes what you do next. For someone recovering from an acute kidney injury, the priority in that critical window is straightforward, but not always easy in practice. Treating and removing whatever caused the injury in the first place, staying appropriately hydrated under medical guidance rather than guessing, and avoiding additional stress on kidneys that are already trying to recover. Here's a detail worth remembering. Some common over-the-counter pain relievers that feel completely harmless in everyday life can put real extra strain on kidneys during this recovery window, which is exactly why checking with a doctor or pharmacist before taking anything extra matters so much during this specific period. For chronic kidney disease, the tools look a little different, but the underlying goal is the same: protect whatever kidney function currently remains and slow the pace of further loss. Keeping blood pressure inside the target range your doctor sets is one of the single most consistent findings across kidney research, because high blood pressure is one of the 2 leading causes of CKD in the first place, right alongside diabetes. Managing blood sugar carefully when diabetes is part of the picture plays a nearly identical protective role over the long run. Diet can matter too, particularly sodium intake, and for some people at certain stages, protein intake, but those specific adjustments should be personalized with a doctor or a renal dietitian rather than pulled from a generic list online, because the right approach can shift significantly depending on exactly what stage someone is in and what other conditions they're managing. A few more practical pieces are worth naming clearly, because a lot of the advice floating around online about flushing or detoxing your kidneys isn't grounded in evidence and can occasionally do more harm than good. Drinking noticeably more water than your body needs doesn't make healthy kidneys work better, and for someone with certain stages of chronic kidney disease, fluid intake actually needs to be managed carefully rather than maximized, which is exactly why that guidance has to come from a doctor who knows someone's specific stage and situation, rather than a general rule that sounds good on the surface. Regular physical activity, maintaining a weight that's healthy for your individual body, not smoking, and limiting alcohol all support kidney health indirectly, mainly by protecting the blood vessels and blood pressure that kidneys depend on to function properly in the first place. Supplements marketed specifically as kidney cleanses or kidney repair formulas don't have strong evidence behind them, and some can actually introduce new strain on kidneys that are already compromised, so it's worth talking to a doctor before adding any of them, even ones that sound gentle or natural on the label. Almost nobody realizes how much of long-term kidney protection actually comes down to consistency rather than intensity. It's rarely one dramatic lifestyle overhaul that protects kidney function over the years. It's showing up for regular blood pressure checks, taking prescribed medications as directed even on the days you feel completely fine, and getting kidney function tested on the schedule your doctor recommends, especially if you have diabetes, high blood pressure, or a family history of kidney disease. Kidney damage is famously quiet in its early stages, often producing no symptoms at all until a meaningful amount of function has already been lost, which is exactly why that routine testing carries so much weight. There's also an emergency category worth naming clearly here: a sudden inability to urinate, severe swelling in the legs or around the eyes that comes on quickly, confusion, chest pain, or shortness of breath alongside kidney-related symptoms are all signs that need immediate medical attention, not a wait-and-see approach, and definitely not a video like this one. If any part of that sounds familiar to you right now, please don't treat this as your next step. Treat a doctor's office or an emergency room as your next step. Today, not next week. So let's finally close the loop we opened at the very beginning of this video. 2 patients, same creatinine level, same day, same hospital. The one whose kidneys were healthy before a sudden infection knocked them down had a genuinely strong chance at real recovery, because acute injury, layered on top of previously healthy tissue, is often reversible once the underlying trigger gets treated in time. The one whose kidneys had been quietly scarred by years of undiagnosed high blood pressure was actually facing a completely different disease underneath an identical-looking lab result on paper, and their path was always going to be about protecting what remained rather than restoring what had already been converted. It's worth saying plainly, one more time, because it's easy to lose in all the detail. Neither of these 2 outcomes should be treated as a verdict on someone's worth, their choices, or how hard they tried to stay healthy. Kidney disease, in both its sudden and its slow-moving forms, often has causes that have nothing to do with anything a person did wrong. Genetics, other illnesses, medications needed for entirely different conditions, and simple bad luck all play a role that's completely outside anyone's control. It's sometimes genuinely. Yes, especially when the damage was sudden and the underlying cause gets identified and treated quickly. And even when full healing isn't realistically on the table, slowing down and holding steady are real, meaningful, medically significant outcomes, not consolation prizes handed out to make bad news feel better. The single biggest factor in either story isn't a supplement, a detox tea, or a miracle diet plan you saw advertised somewhere. It's catching what's actually happening early enough, through routine testing, and an honest, ongoing conversation with your doctor about your specific numbers, your specific risk factors, and your specific numbers, your specific risk factors, and your specific plan going forward from here. No 2 kidneys and no 2 stories are ever quite the same, even when the numbers on day 1 look identical. If this helped you actually understand what's happening with your kidneys, or with someone else's, drop a comment below and let us know which part surprised you the most. And if you want more videos that take confusing medical topics and turn them into something clear, calm, and genuinely useful, go ahead and subscribe, because there's a lot more of this ahead.